Good evening. Here's our news bulletin for tonight. The Niue Health Department is reviewing its policy for the usage of the hospital ambulance. A clash in dates for the Tamgotonga and Lakapa Village show days will now have both show days held back-to-back. Eye specialists have returned to do follow-ups with patients who have diabetes. The Niuean online community is buzzing with excitement with the release of extraordinary images that were taken in Niue. The Niue Health Department is in the process of reviewing its policies and operating procedures for the hospital ambulance. The issue was raised following some confusion, particularly with the policy that restricts the use of the ambulance to transport a deceased person from their home to the morgue. Bereavement is a sensitive time for families, and the issue of transportation for the deceased is one that needs to be resolved. Niue does not have any specialized undertaker or mortuary services, and often there are assumptions that because the morgue is located at the hospital, the department would be able to assist. However, that is not the case, and this is a policy that has been in place since 2005. For families dealing with the loss of a loved one, this policy seems insensitive, but the department is addressing the issue. We were unable to get a comment from the Niue Health Department at this point in time, but they are now relooking and reviewing their policies and will inform the public as soon as a decision is made. A clash of dates and discussions between the village councils of Lakapa and Tamgotonga could see both village show days held back-to-back. Village show days are an opportunity for communities to come together and showcase community spirit. Each year, Niue Tourism send out requests for the community to inform them of any planned activities to be included in the 18-month calendar of events. The Lakapa Village Council Chairman said that they had sent formal confirmation and information regarding their show day dates back in March. This has also been relayed to the community overseas to be able to make arrangements for bookings. They have groups expected to arrive, and it is now far too late to make any changes. However, the Tamgotonga Village Council says that Tamgotonga has always been the first to hold the show day in August, and normally both villages would discuss with each other. But with a change in leadership, this year has been slightly different. Their village is also expecting groups of people arriving for their show day, and they are unable to change to a later date. A meeting was requested for both village councils to discuss this matter, and there are strong opinions from both sides. Niue Tourism has stated that the village councils will need to find a resolution, as the department is in no position to make a decision. Tamgotonga held a village meeting on Sunday and decided they will now be holding their show day on Friday the 12th of August, which means Lakapa's will be held the following day on Saturday the 13th of August. What effect this may have on the wider community expected to turn up in support is yet to be seen. A team of eye specialists from the Pol Clinic are back on the island to do a follow-up of screening tests that were conducted last year. Throughout the week, the team has been busy trying to see as many diabetics as possible as part of the diabetes eyes testing service. We caught up with the team today to find out a bit more about the work that they're doing and what effects diabetes can have.
Well, the main thing diabetes affects is the retina, which is the sort of lining in the back of the eye that you see with. It's like the film in a camera, and it causes leaking from the blood vessels in the retina, so you get bleeding spots and swelling in the retina. Sometimes you can have some diabetes effects without it really affecting your vision, and so that's why we need to check so that we can test for it and find it before it gets too bad. Once it gets to the stage where it's affecting the vision, sometimes it's too late, but often we can treat it if we pick it up early and prevent going blind or losing vision from diabetes. Well, you can go blind from diabetes in the eyes, and some people do, but fortunately with the screening program we can pick it up much earlier and prevent that. But if it's left too late, the bleeding can get really bad in the eye, so you can lose vision from bleeding, or you can get scarring that causes retinal detachment. And once that happens, often the vision loss is permanent. So sometimes if it's left too late, we actually can't do anything very much.
Diabetics have a higher risk of vision loss and vision impairment. This is an ongoing program to improve healthcare for those who have problems with their eyes. The team this time around has a slightly different approach in comparison to last year.
We have Shah, who's the nurse, Raina, who's a photo screener, and myself, the specialist, really primarily to see as many diabetics as we can. Raina's taking photos of their eyes, and often we can see how bad the diabetes is affecting them just from the photos. And some patients we can't get good photos, and so I'll have a look at them myself. Or some have some significant diabetes, eye disease, and so some of them, a few I can treat here, not that many, but a lot of them I'm having to send back to New Zealand for some follow-up and treatment there. Last year's was a little bit different. We had the full eye team last year, so it was myself and Sarah Welsh, the other eye specialist. So we were both here for a week, and as well as Raina was here for 2 weeks doing the photos. So as well as seeing all the diabetics, we were doing cataract surgery and other minor surgeries and things like that last year. This year we didn't bring all the equipment to do surgery, and I'm only here for a few days, so it's really just concentrating on the diabetics and getting the photos done, as many as possible, and then reviewing them myself, sort of those who need it. So it's a more focused, I guess, look, particularly at the diabetics. Having said that, we see whoever walks in the door, and there are a few patients with all sorts of other things as well.
The team has managed to take photos of almost 100 patients' eyes, and almost half of them have been in for further assessment. Early detection and prevention is important, especially for diabetics. However, treatment is dependent on the severity of the condition, but the caution is for people to take better care of their health and minimize the potential impacts.
So a lot of people ask me, what can I do to help my eyes? And really the answer is to manage the diabetes. It's to keep the sugar levels as well controlled as you can. It doesn't make much effect in the short term, but over many years it has a huge effect. And diabetes in the eye, sometimes we see the bleeding and things just disappear. It can go away completely sometimes, just with good management of the blood sugars. So I guess that's watching the diet, keeping in touch with the doctors and nurses here to monitor the diabetes and make sure their treatment's appropriate. So it's just sort of keeping on top of that, and then you have the benefits of that sort of years down the line.
Medical treatment is available, but specialists say that there has to be some level of personal care as well as healthier lifestyle choices. The eye team will be departing tomorrow and will be back again next year. An individual's creative project featuring Niue as a backdrop has the Niuean online community buzzing with excitement. Connor Brown, who is from New Zealand, was on the island a few weeks ago on holiday when he decided to use the natural landscape for his personal project, or a photo shoot of sorts. For locals on the island, seeing someone dressed up as a character from Assassin's Creed was both surprising and out of the ordinary. Having completed a Level 5 production design and sculpting course with excellence in Auckland, Connor decided to put that to use and started constructing the Assassin's Creed costume that was mostly handmade. He says that the link to the island of Niue and the reason that they chose Niue as a holiday destination was because his grandmother was a founder of the nursing school in Niue back in the 60s, and the family made their first trip to Niue last year. They were so intrigued that they returned again this year. He says the response that he has received about the photos has blown him away, as it has been the most liked, shared and commented post he has ever had. The photographs show many of Niue's scenic attractions and provides free advertising and marketing for the island using social media. Those are our news stories that we have for you for this evening. We do hope that you can join us again for our next news bulletin next week.